Hey Facebook, so today isn't a rant, today is just a bit of information. Uh, I'm going to get a test today. It's called a Coronary Artery Calcium Scoring test. And the purpose of this test is to show how much calcification is in your coronary arteries. So for me, I have a pretty bad family history. My father had a heart attack at 51. So for me, I want to know what's going on inside of there as far as calcification inside of these arteries. So this is a test. Your insurance won't cover it, you'll have to pay for it yourself, but guess what, you get to keep the information too, so you don't have to worry about your insurance company getting it or anything and changing your rates or whatever if you're a risk. But it also is kind of a warning sign, so to speak. So if you have a lot of calcification in your coronary arteries, your risk of heart event, a myocardial infarction, is way higher. So if you get this test, you'll know, and then you can start to make lifestyle changes. The problem with a lot of the testing that's already available for cardiac people is they do cholesterol and they can do EKGs, and then the next day, after you get a clear bill of health from your doctor, you could have a massive heart attack and die. And the reason is though they don't tell you about an impending event. They only tell you blood lipid concentrations. They only tell you if your electrical rhythm is okay. They do not tell you how much disease is already there. And that's an important thing. So when you get to middle age, there's a particular cardiac event, and they call it the widowmaker, and it's the descending coronary artery. And you could be an otherwise quote-unquote healthy person and have a heart attack because that widowmaker will close down, that coronary artery will close down. And there's no good way of knowing other than doing a coronary artery calcium screening or calcium scoring test. It's actually a CAT scan, so it is radiation, so you don't do this all the time. It's not necessarily good for you, but the amount of information is beneficial, so much so that it overweighs the exposure to the radiation. It wouldn't even be something I necessarily do every year, but middle-aged person, probably a good idea to do it. Bad family history, bad heart family history specifically. All of my other stuff is good, my EKGs and stuff, my lipids are good. Otherwise, quote-unquote healthy as far as medical chemistries and things are concerned, but it's good to have a test like this because it's going to give you a wealth of information that you don't have. Some places require a prescription, other places don't. It costs about $100 or so. Shouldn't be a lot more than that. It's something they do pretty quickly, but it is a good indicator as to what might be happening inside of you. And I don't think that there are other indicators for this particular condition that are anywhere near as good. So this is something that you can do, you should do. If you're one of my patients and you want me to send you, I'll send you, because I think it's a benefit. If you come back and you have some information that is not particularly good, then there are particular steps you can take that don't involve taking a bunch of statin medications, because the statin medications, I don't think they save lives. The numbers on it are kind of sad. It says that basically 1,000 people need to be on a statin for one person to benefit. So there's what's called real risk versus raw, and the data gets manipulated. So if you have 1,000 people in a study and 4 people have heart attacks in the control group, but only 2 people have heart attacks in the treatment group, then they say that that's a 50% reduction. But in reality, it's the difference between 0.002 and 0.004. And so reality of it is the raw versus the real risks are vastly different. But when they put that drug out there to sell, they're going to say it causes a 50% reduction in cardiac events. Well, we're talking about the difference between 4 and 2 people, and they may have had cardiac events anyway, even with or without the statin. So the drugs you have to be careful with. I'm not telling you don't take them. I wouldn't take them, but I'm not telling you not to take them because I'm not your doctor. But there are a lot of other things you can do, a lot of other blood work, screening. I think you need to get your ferritin levels checked, your fasting insulin levels checked, of course your triglycerides, your cholesterols. If you're a cardiac risk person, you probably should have what's called a VAP, which is a vertical axis profile, and it shows you a bunch of other things. I also like to know, I don't know if I said it already, ferritin and GGT are good numbers, good tests to have to know what your actual cardiac risk is. And then you can make a plan. But right now what you do is you get a total cholesterol level, HDL and LDL, and then from there they decide whether they're going to put you on a statin medication or not. And unfortunately 50% of people have cardiac events, have normal cholesterol, and the people who are on high cholesterol without cardiac events, putting on statins don't necessarily show a benefit. So it's a slippery slope. So what you can do is you can educate yourself, and this is how you do it. So you ask your healthcare provider, chiropractor can send you, family doctor, whoever, you say, I want to have a coronary artery calcium scoring test. And so what that's going to do is they're going to take you in, you're going to go into a tube, which I'm getting ready to go in a minute, so I'm going to cut this off fast. But you go into the CAT scan, you have a CAT scan basically of your heart, and it watches your heart in motion. And that's what this technology enabled this to happen, which it couldn't happen before, but now it can because they have these high-speed images. So you can get a lot of information this way, and then you could just know, okay, perhaps maybe this is something I should be looking at, I should be taking precautions, I should be doing. So coronary artery calcium scoring, and that's what it is. Good test. Insurance probably won't cover it, be around $100, but it could give you information that could absolutely positively save your life. So that's the thing about it. If you get a bad test, then at least you can go to your doctor and say, hey, look, I have a bunch of calcium in my coronary arteries. What are we going to do about this? And you could go that route, and you could do that for sure. So good test, simple test, fast tests, won't take long. I'm going in to have it today. So because of my family history, like I said, my dad had a heart attack early on, so I don't want that to be me, so I'm going to go ahead and get this test and then take that information and make changes if I need to. All right, that's it. Take care. If you have questions, leave them here. I will kind of give a little information more after I get back, and I'll try to brush up on this a little bit. All right, have a good day. Take care.